Hi everyone, I'm Anjana Baby, Assistant Professor at Nirmala College of Pharmacy. Today, I'm going to talk to you about venomous snake bite, which is an important topic in clinical toxicology and is especially relevant for fourth year family students. And in this session, we will be covering various aspects, including the families of venomous snakes, clinical aspects of venom, general management, early manifestation, and complications of snake bite injuries. So, let's begin the session. The venomous snakes are mainly divided into five families according to the structure of their fangs and the nature of their venoms. The fangs means the long, sharp, specialized teeth in some snakes that are used to inject venom into their prey or enemies. The first family is Colubridae. Colubridae is the largest family of snakes containing around 1400 species, which account for nearly 75% of all snake genera. Most members of this family are non-venomous, but a few species possess mild venom that is not usually dangerous to humans. And they typically have short, immobile fangs or enlarged teeth, and many species have rare position fangs known as opistoglyphous fangs. Opistoglyphous. And unlike highly venomous snakes, colubridae snakes do not inject venom quickly. Instead, they deliver venom by chewing, allowing it to flow into the wounds. And these snakes are widely distributed across the world and are found in forests, grassland, and even near human settlement. However, they are largely absent in Australia. Common examples include rat snakes, garter snakes, hognose snakes, and mountain racers. These are some examples. From a clinical point of view, bites from colubridae snakes are usually harmless, causing only mild symptoms like slight pain or swelling. Serious effects are very rare. Overall, colubridae snakes plays an important role in the ecosystem by controlling pests like rodents and insects. The next category is Arthractaspididae. As a family of venomous snake mainly found in Africa and in Middle East. They are commonly known as burrowing asp, mole vipers, and stiletto snakes. These are other names. And these snakes usually live underground and are adopted for a burrowing lifestyle. A key feature of this family is their long front fangs and a very unique biting mechanism. Unlike most snakes, they can deliver a side stabbing bite instead of striking forward, and they are also able to inject venom without fully opening their mouth. And this makes them particularly dangerous because they can bite even when being handled or restrained. So it is very dangerous. From a clinical point of view, their bite can be serious mainly due to this unusual and hard to avoid biting method. The next category is Elapidae. Elapidae is a family of highly venomous snake characterized by short fixed front fangs known as protyroglyphous fangs. And these fangs are located at the front of the upper jaw and may reach up to about 10 millimeters in length. And unlike some other snakes, elapids inject venom efficiently during a quick bite. And this family include well-known snakes such as the Indian cobra, means മൂർഖൻ പാമ്പിനെയാണ് ഉദ്ദേശിക്കുന്നത്. Then crates like the common crates, അത് വെള്ളിക്കെട്ടനാണ്. And coral snakes such as micrurus and mambas like black mamba. The venom of Elapidae snakes is mainly neurotoxic, meaning they affect the nervous system. Clinically, this can lead to symptoms such as drooping of the eyelid, known as ptosis. Drooping of the eyelid is also known as ptosis, also നിങ്ങൾക്കറിയാം, and followed by muscle paralysis. In severe cases, it can cause respiratory failure, which can be life-threatening if not treated quickly. And overall, Elapidae snakes are medically very important due to their potent neurotoxic venom. Next family is Viperidae. Viperidae is a family of highly specialized venomous snakes. They are known for their long, curved, and hinged fangs called solenoglyphous fangs. And these fangs work like a hypodermic needle, allowing a deep and efficient injection of venom. And when the mouth is closed, the fangs fall back against the roof of the mouth and swing forward when the snake strikes. This mechanism helps vipers deliver a powerful and fast bite, which is extremely dangerous feature of this family of snakes. And one important subgroup is Viperinae, also known as true vipers, which include vipers and adders such as Russell's viper. The venom is mainly hemotoxic, meaning it damages blood and tissues. Clinically, bite can cause pain and swelling, bleeding, and tissue destruction. And Viperidae snakes are dangerous due to their advanced fang system and strong venom. Next category is Crotalinae, also known as pit vipers, are a subgroup of the viper family, and they have a special heat sensitive organ which makes the snakes some more special. The special heat sensitive organ is also known as pit organ, located between the eye and the nostril. This organ helps them detect heat, allowing them to accurately locate warm-blooded prey even in the dark. Examples include rattler snakes and Asian pit vipers such as Trimeresurus and Hypnale. And the venom of pit vipers are mainly hemotoxic or vasculotoxic, meaning it affects the blood and blood vessels. Clinically, bites causes severe pain and swelling at the side. They may also lead to bleeding disorders and in serious cases tissue necrosis, which is the death of the affected tissue. Overall, pit vipers are medically important due to their potent venom and advanced heat sensitive ability. The next category is Hydrophidae, commonly known as sea snakes, are a group of venomous snakes, especially specifically adapted to life in the ocean. And unlike land snakes, they have a laterally flattened tail which acts like a paddle, helping them swim efficiently. And these snakes spend most of their lives in water and are highly adapted to the marine environment. Despite their calm appearance, sea snakes possess extremely potent venom, and their venom mainly affects the muscles, which is why it is called myotoxic. After a bite, symptoms may not be very noticeable at first, with minimal swelling at the side. However, the venom gradually causes muscle breakdown and a condition known as rhabdomyolysis. And this can lead to serious complications, including kidney failure if not treated in time. In India, there are approximately 330 species of snakes. Out of this, around 70 species are venomous. Among the venomous snakes, about 40 are terrestrial, meaning they live on land, and around 30 are maritime, found in coastal waters. Now, among all these species, a group known as the Big Four is especially important. These snakes are responsible for the majority of snake bite cases in India. They include the common crate, the Indian cobra, the saw-scaled viper, and Russell's viper. These four species are medically very significant because they are responsible for more serious envenomation cases and fatality. So, understanding these snakes is crucial for effective treatment and prevention of snake bite complications. Apart from the Big Four, there are several other important venomous snakes in India. Among them, pit vipers are significant. These include the bamboo pit vipers, the Himalayan vipers, and the ham-nosed vipers. And other noticeable species include the king cobra, which is the longest venomous snakes in the world, and coral snakes like Calliophis. And marine environment, an important example is the sea snake, beaked sea snake, also known as the hook-nosed sea snake. Although these snakes may cause fewer bites compared to the big four, they are still medically important due to their potent venom. So, awareness of this species is also essential for proper diagnosis and treatment of snakebite cases. Now, let's take a look at some common venomous snake. Common cobra, monocellate cobra, black cobra, common kraits, scale viper, Russell's viper. Russell's viper fangs. You can see, take a look at this slide. You can see the fangs of the Russell's viper here. King cobra, banded kraits, green pit viper, Malabar pit viper, ham-nose pit viper, coral snakes, beaked sea snake, the World Health Organization classified Indian snakes based on their medical importance and the severity of envenomation into different categories. First one, class 1 include highly dangerous snakes which have major public health importance. Yes, these snakes causes death or serious disability if not treated promptly. Important examples include Indian cobra and Russell's viper. Then class 2 include snakes of moderate medical importance. Bites from these snakes are less common, but they can still cause severe envenomation. In some cases, they may lead to death or local tissue damage known as necrosis. Examples include common krait and king cobra. So, although less frequently encountered, these snakes remain medically important and should be treated with caution. Class 3 includes snakes of low medical importance. Bites from these snakes are relatively common, but serious systemic effects are rare. Most bites cause only mild symptoms such as slight pain or local swelling. Examples include the oriental rat snake and checkered keelback, the common bronze-backed tree snake, and green vine snakes, and wolf snakes from the Lycodon. So, although these snakes may bite more frequently, they are generally not dangerous and rarely cause serious health problems. Now, let's look at the clinical features of a non-venomous snake bite. In many cases, the symptoms are not due to venom but are caused by physiological shock. This happens because of fear and anxiety associated with snake bite. Common features include giddiness, fainting, sweating, palpitation, increased heart rate, and low blood pressure. These symptoms can occur even if the snake is non-venomous. However, recovery is usually rapid, especially after reassurance. Once a doctor confirms that the bite is non-venomous, the patient often improves quickly. So, proper reassurance plays an important role in management. Now, let's discuss venomous snake bite, specifically cases without envenomation, also known as dry bite. Even highly venomous snakes do not always inject venom. In fact, this can occur about 20 to 50% of cases. There are several reasons for this. First, a dry bite where no venom is released. Second, protective clothing may prevent venom from entering the body. Third, venom may leak out, especially in bites over the head or surface areas. And finally, superficial or defensive bite, where the snake does not strike deeply. In such cases, there are little to no signs of envenomation. However, careful observation is still important to rule out delayed symptoms. Now, let's look at venomous snake bite with envenomation. First, colubrid bites. This bite usually produce mild and localized symptoms like pain, swelling, redness, and sometimes numbness. In most cases, these symptoms are not severe and remain limited to the bite area. Typically, they resolve on their own within 1 to 2 weeks. So, colubrid bites are generally mild and rarely cause serious complication. Next, elapid bite, such as those from the Indian cobra and the common crate. The local effects are usually mild with pain and slightly swelling at the bite side. Sometimes there may be a blood-tinged fluid discharge and blister formation. However, cobra bites can be more severe. They may cause significant swelling and tissue necrosis, which means tissue death. In some cases, this can progress to gangrene, wet type in the early stage and dry type later. Secondary infections may occur, although it is less common. So while many elapid bite shows mild local effect, cobra bite can lead to serious tissue damage. Now let's look at the systemic effect, especially the early neurotoxic stage. In the pre-paralytic stage, the patient may first experience vomiting, and this is often followed by ptosis, which is drooping of the eyelid. They may also develop blurred vision and weakness of the eye muscles. As the condition progresses, difficulty in speaking, known as dysarthria, may occur. Some patients report numbness, especially around the mouth. Other symptoms include headache, dizziness, excessive salivations, etc. So, these early signs indicate the beginning of neurotoxic effects and require prompt medical attention. In the late stage, also known as the paralytic stage, the neurotoxic effects become more severe. There is progressive paralysis affecting different muscle groups, and these include the facial muscles leading to loss of expression. The jaw and tongue may become weak and making it difficult to speak or eat. Then the vocal cord can also be affected, causing changes in voice and inability to speak. In the case of neck muscles and swallowing muscles become weak, leading to difficulty in holding the head up and troubling swallowing. If this paralysis continue, it can involve the respiratory muscles, and this may lead to respiratory failure, which can be life-threatening if not treated immediately. So, early recognition and prompt treatments are critical to prevent serious complications. And in advanced or severe elapid bites, the patient enters the paralytic stage. There is progressive flaccid paralysis of all muscles. This patient may find it difficult to open the mouth or speak clearly. As the condition worsens, respiratory complications can develop. And respiratory errors may occur due to airway obstructions caused by a paralyzed tongue or even vomitus. In addition, paralysis of the intercostal muscles and the diaphragm further affects breathing. A typical sign seen here is paradoxical respiration, where the chest and abdomen move abnormally during breathing. And regarding consciousness, patient may appear unconscious but can still respond to simple commands like moving a finger or toe. True loss of consciousness and convulsions are usually late signs and occurs due to lack of oxygen known as hypoxemia. So, the severe features indicate medical emergency requiring immediate intervention. Now let's look at cobra bites, such as those caused by the monocled cobra. Increasingly, about 50% of cases may show no envenomation. When venom is present, local effects usually begin within 2 or 3 hours. The patient may experience pain and swelling, which typically peak within 24 to 48 hours. Blisters may form and the skin can become discolored, eventually leading to tissue necrosis and sloughing. In addition to local effect, cobra venom also causes neurotoxicity. This usually begins within 1 to 5 hours, although in some cases it may be delayed up to 19 hours. It often starts with cranial nerve involvement and may progress to respiratory failure if not treated promptly. So, cobra bites can present with both local tissue damage and serious neurotoxic effects. Now, let's look at some other features. Renal complications are rare. Coagulation disorders are also uncommon, but in some cases, disseminated intravascular coagulation or DIC may develop. Coming into coral snake bite, they are usually milder in comparison. With timely treatment, patients generally slow good recovery. So, although these complications are less common, careful monitoring is still important. Now, let's discuss viperate bites. The local effects usually have a rapid onset, often within 30 minutes, although sometimes they may be delayed. One of the main features is severe swelling, which starts at the bite site and gradually spreads to the entire limb and even nearby parts of the trunk. This is often accompanied by pain and marked tenderness. Patient may also develop regional lymph node enlargement known as lymphadenopathy. Another important feature is bruising, especially along the superficial veins. So, viper bites are characterized by rapid and severe local tissue reactions. One of the key features of viper bites is persistent bleeding from the bite side. Blisters may begin to appear around 12 hours after the bite and can gradually spread over the affected limbs. As the condition progresses, it leads to extensive tissue damage. These include necrosis involving the skin, subcutaneous tissue, and even muscles. Another serious complication is compartment syndrome. This occurs due to increased pressure within tight facial spaces. Clinically, it presents with severe pain, tense swelling, and reduced sensation known as subcutaneous anesthesia. There is also pain when the affected muscles are stretched. So, these features indicate severe local damage and require urgent medical attention. Now let's look at the systemic effects of viper bites, which are mainly hemotoxic. A hallmark feature is coagulation abnormality, meaning the blood loses its ability to clot properly In the early stages, patient may have persistent bleeding from the bite side, and they may also develop hematuria, which is blood in the urine, and often within a few hours. As the condition progress, other bleeding manifestation may appear. These include bleeding from the gums, known as gingival bleeding. There may also be nosebleeds, called epistaxis, and rarely coughing of blood or hemoptysis. Some patients may have vomiting of blood, known as hematemesis, bruising under the skin or ecchymosis can also be seen. So these bleeding tendencies are key indications of hemotoxic envenomations in whipperbits. Then, in severe whipper envenomation, bleeding can occur in multiple parts of the body. These include the intracranial hemorrhage and subconjunctival hemorrhage affecting the eyes. And bleeding may occur into the mouth, the tympanic membrane, and the gastrointestinal tract and the genitourinary tract. In some cases, severe complications can develop. For example, bleeding in the pituitary gland can lead to a condition similar to Sheehan syndrome. And subarachnoid hemorrhage may occur, presenting with severe headache and signs of meningism. And intracranial hemorrhage can result in hemiplegia, coma, or convulsion. And bleeding into the abdomen, such as retroperitoneal or intraperitoneal hemorrhage, may cause abdominal distension and tenderness. And signs of peritonism may also be present. In severe cases, this can progress to hemorrhagic shock, which is life threatening. So, these complications highlight the severe systemic impact of whipper venom. Now, let's look at the some Now, let's look at some additional features of whipperid envenomation. First, the effects on blood and coagulation. The venom can cause the blood to become incoagulable due to defibrillation, meaning clotting factors are depleted. This may also lead to intravascular hemolysis, where the red blood cells are destroyed. This releases hemoglobin into the urine, known as hemoglobinuria, which can contribute to the renal failure. This complication is commonly seen in bites from the Russell viper. Next, renal complication. Acute renal failure is a common and serious outcome. It is often associated with disseminated intravascular coagulation, leading to damage of kidney tubule and even cortical necrosis due to microthrombi formation. In some cases, kidney damage may occur due to the direct toxic effects of venom. These complications are commonly seen in the Rustler viper and the Hypnale, and they are relatively rare in bites from the Sioux scale viper. So, whipperid envenomation can significantly affect both blood and kidney function, leading to serious complications. Now, let's look at the cardiovascular effects of whipper envenomation. Patient may develop hypertension along with tachycardia. In some cases, if the heart is involved, the pulse may become slow or irregular. Another important aspect is the difference between fibrinolysis and disseminated intravascular coagulations, or DIC. In bile from the source scale vipers, bleeding may occur due to primary pathological fibrinolysis, also known as PPF. And this is important clinically because treatment differs. For example, heparin, which is sometimes used in DIC, can actually worsen bleeding in areas of PPF. So, identifying the correct mechanism is essential for proper management. Now, let's look at the cardiac and neurological effects. Vapor environment may cause cardiotoxicity leading to changes in the ECG. And the neurological features are especially sin and bites from the rustler vapor, and these may include ptosis and other neurological symptoms. In rare cases, generalized flaccid paralysis can occur due to the actions of phospholipase A2, and this is important to note that elapid snakes mainly cause neurotoxicity without affecting blood coagulation. Now, moving on to the next category, hydrophyte or sea snake bite. In most cases, local symptoms are minimal or even completely absent. The bite is often painless and may go unnoticed. And the fang marks appears as small punctures or scratch-like marks on the skin. Sometimes the teeth may even remain in the wound, and there is usually little or no swelling, and lymph node enlargement is uncommon. So despite a potentially serious bite, a local signs may be very subtle and easily overlooked. Now let's look at the systemic effects, which are mainly myotoxic. The primary effect is on muscles or on kidney. Patients may develop muscle pain, stiffness, and tenderness, usually within 30 minutes of 2 hours, and this occurs due to muscle breakdown known as rhabdomyolysis, and as a result, muscle protein enters into the bloodstream and leading to myoglobinemia and myoglobinuria. Myoglobin excessive, myoglobin content in the urine, and this can eventually cause acute renal failure with reduced urine output and raising urea levels. In terms of neuromuscular effects, trismus or difficulty in opening the mouth may appear early, and patient may also feel pain when muscles are partially stretched, and later flaccid paralysis can develop, often starting with ptosis. So even though local signs are minimal, systemic effects can be severe and require urgent treatment. Now let's look at electrolyte and cardiac effects. There is severe muscle breakdown, potassium levels in the blood may rise, a condition known as hyperkalemia. This is dangerous because it can lead to cardiac arrest. On ECG, typical changes include tall peaked T waves and a widened QRS complex. In addition, patient may experience general symptoms such as dizziness, nausea, vomiting, headache, and sweating. So, electrolyte imbalance, especially hyperkalemia, is a serious complications that require immediate attention. Now, let's look at the neurotoxic effects. Early signs include ptosis and ophthalmoplegia, which is a weakness of eye movement. Patient may develop difficulty in speaking, known as dysarthria, along with blurred or double vision. Pupil dilation or mydriasis may also be seen. As weakness progresses, the patient may be unable to sit or stand. Reflexes become depressed and leading to flaccid paralysis. Eventually, the respiratory muscles may become paralyzed, which can lead to death if not treated. However, unconsciousness is usually preserved until the late stages. A failing vision is often considered a terminal sign. The overall fatality rate is around 3%. So, early recognition and prompt treatment are essential to prevent serious outcome. Now I am going to explain how we diagnose a snake bite. Okay. Very first, typically, uh, when it comes to the fang marks, typically there are two puncture wounds, which may be about 8 millimeters to 4 centimeter apart, depending on the species. However, there can be variations. Sometimes only a single puncture mark may be seen due to a sidewise bite. In other cases, there may be multiple marks due to repeated bites or multiple fangs. Even non-venomous snakes like the wolf snake can produce similar looking bite marks. And importantly, fang marks may sometimes be absent or unclear. Next, identification of snake. This may be possible if the dead snake is brought along, but extreme caution is required. Even a dead snake can cause reflex bite, and a severe head can still be dangerous. So identification should always be done carefully and safely. Now let's look at laboratory investigations in snake bite. First, hematological findings. Patient may show anemia, leukocytosis, and thrombocytopenia. Initially, the hematocrit may be increased, but later it decreased. Hemolysis may be present with characteristic schistocytes, also known as helmet cells. There are also coagulation defects. These include prolonged clotting time, prolonged prothrombin time, and PTT. Fibrin degradation products are also increased. Next, ECG findings. This may show bradycardia, ST segment elevations or depression, T wave inversion, and QT prolongation may also be seen. Some of these changes are due to hypokalemia. So, laboratory investigations plays an important role in assessing severity and guiding management. Now let's look at metabolic, urinary, and renal changes. First, metabolic effects. Hyperkalemia may occur due to cell and muscle breakdown. Patient may also develop hypoxemia along with respiratory acidosis. In addition, metabolic or lactic acidosis with an increased anion gap may be seen. Next, urinary findings. These may include hematuria, which is blood in urine. Proteinuria may also be present. In some cases, hemoglobinuria or myoglobinuria can occur. Finally, renal effect. Patient may develop features of acute renal failure such as azotemia. So these changes indicate significant systemic involvement and require close monitoring. Now let's look at imaging in snake bite. First, chest X-ray. This may show pulmonary edema, intrapulmonary hemorrhage, or pleural effusions. This finding indicates systemic complications. And X-ray of the bite site. This is useful to detect any retained fangs or tooth fragments. So imaging plays a supportive role in identifying complications and guiding further management. The final one is immunodiagnosis in snake bite. One of the main methods used is ELISA. ELISA helps detect venom antigens in body fluids with high sensitivity. However, it has limited specificity for identifying the exact snake species. This method is especially useful in forensic cases such as detecting venom from snakes like the Indian cobra and the common kraits. There are also advanced techniques. These include IgY based sandwich ELISA and inter commodity inhibition ELISA. Special preservatives are used for sample storage, especially in forensic analysis. So, Immunodiagnosis plays an important role in confirming snake bite, particularly in medical legal situations. So this is all about the diagnosis of snake bite. Now let's discuss the first aid measures in snake bite injuries. First, verbal reassurance. As I told earlier, most snake bites are either non-venomous or not life-threatening. However, anxiety and fear can trigger neurogenic shock. So, it is important to calm the patient and prevent panic. The next is immobilization. Absolute rest is essential as it helps reduce the spread of venom all through the lymphatic system. The bitten limb should be immobilized using a splint and a sling. It should be kept below the level of the heart to slow down venom circulation. Also, remove any rings, bangles, or tight clothing to prevent complications from swelling. So, early reassurance and proper immobilizations are key steps in first aid. Now let's look at specific first aid methods used in snake bite. First, pressure immobilization, also known as Sutherland method. In this technique, a firm crepe bandage is applied along with a split to immobilize the splint, to immobilize the limb. This helps to slow down the spread of venom through the lymphatic system. However, it should be avoided or incised wounds or areas with severe bruising. Next, the local compression pad, also called Monash method. Here, a firm rubber pad is placed directly on the bite side and secured with a bandage. This method can be useful especially in bites from the Russell's viper, but it must be used with caution as it may increase local tissue damage and leading to necrosis, pain, and bruising. So, while this method can be helpful, proper technique and careful use are very important. Next, beverages. Coffee and other stimulants should be avoided as they may induce vomiting. Alcohol is strictly contraindicated because it can increase the absorption of venom. Now coming to tourniquets. In the past, tourniquets were used to block the spread of venom through the lymphatic system. However, their use is now discouraged due to potential complications. So, proper first aid, avoid harmless practices, or focus on safe management. However, tourniquets are not now recommended due to serious complications. They can cause reduced blood supply, leading to ischemia and even gangrene. There is also risk of nerve damage such as injuries to peripheral nerves. In addition, tourniquets may increase swelling, bleeding, and fibrinolysis. They can worsen local tissue damage, making the injury more severe. Another major danger is a sudden release of tourniquet. This can cause rapid spread of venom into the systemic circulations, which may be life-threatening. So, tourniquet should be avoided in modern snakebite first aid. Now let's look at the contraindicated first aid measures, specifically the use of a tourniquet. A tourniquet may initially prevent the spread of venom through the lymphatic system. However, when it is suddenly released, as I told earlier, it can cause a rapid flooding of accumulated venom into the systemic circulations, which can be life-threatening. There are several complications associated with its use. It can lead to reduced blood supply, causing ischemia and even gangrene. There are also a risk of peripheral nerve damage. In addition, it may increase swelling, bleeding, and fibrinolysis. And it can cause, also enhances the local effects of venom, worsening tissue damage. So, due to these serious complications, the use of tourniquet is not recommended. This method, next, incisions and suction. This method was previously used as a first aid measures, but is not controversial and generally discouraged. its effectiveness is debated, and some reports suggest that it may remove up to 90% of venom even after 2 hours. However, their studies shows only about 20% removal. There are there are several risks associated with this method. It can cause uncontrolled bleeding, especially in vapor bites and where blood does not clot properly. And there is also a risk of injury to nerves, blood vessels, and tendons. Infections is other possible complications. So most authorities consider this method hazardous and ineffective. If incisions and suctions are attempted, although not advised, certain precautions must be followed. Cruciate or crow-shaped incisions should be avoided. Instead, parallel incisions should be made through the fang marks. These incisions should be small, about 1 centimeter in length, and not more than 3 millimeters deep, and they should be made along the long axis of the limb. And now, coming to cryotherapy or ice application, this was previously recommended to reduce venom absorption. However, it is not universally contraindicated, and this is because it can cause tissue necrosis leading to gangrene, and in severe cases, this may even require amputations. So, both these methods should be avoided in modern snakebite management. The next one is electric shock therapy. This method has doubtful effectiveness and is now considered both useless and dangerous. So it is not recommended. Now coming into drug and supportive care. For pain relief, mild to moderate pain can be managed with paracetamol. In cases of severe pain, stronger medication such as narcotics may be used with caution. And examples include pentazocine, pethidines, etc. However, these drugs must be used carefully because they can cause central nervous system depression. This is especially important in elapid bites where the neurotoxicity is already present. So, proper pain management with careful drug selection is essential in snakebite care. Aspirin and other non-steroidal anti-inflammatory drugs should be avoided. This is because they increase the risk of gastric bleeding, especially in vapor bites, where the blood may already be incoagulable. Now coming to steroids and antihistamines, these are not routinely used in snakebite management. However, they may be given in cases of allergic reactions, particularly due to antivenom. So the use is limited and should be carefully indicated. Now let's look at the management of vomiting. Vomiting is a common early symptoms in snakebite cases. The patient should be kept in a lateral position with the head turned to the side and slightly lower to prevent aspiration. If vomiting is persistent, it may be treated with intravenous medication such as chlorpromazine. Next, injections and bleeding precautions. When it comes to injections and bleeding precautions, intramuscular and subcutaneous injection should be avoided as they can lead to hematoma formation, and this is especially important in cases with bleeding disorders. If venipuncture is performed, firm pressure should be applied to the side to prevent bleeding. So careful supportive care help prevent complications and improve patient safety. Now, let's discuss antibiotic and tetanus prophylaxis. The use of antibiotic in snake bite is controversial, but uh, routine prophylactic use is not universally recommended. However, they may be considered in cases with severe signs of infections. Next, tetanus prophylaxis. This is important due to the risk of wound contaminations and infections. Tetanus toxoid should be given to provide protection if the patient is not previously immunized. Tetanus antiserum or human immunoglobulin should be administered. So, proper infections prevention is an essential part of snakebite management.